Health info. Bringing you well-researched medical information. Heart attack or myocardial infarction. A heart attack, scientifically known as a myocardial infarction, happens when there is a blockage in the blood vessels that supply the heart with oxygen and nutrients. This blockage is usually caused by a buildup of fatty deposits called plaque. Smoking, an unhealthy diet, lack of exercise, and high blood pressure can increase the risk of developing this plaque. Risk factors for heart attack. Studies show that individuals with these risk factors have a higher chance of experiencing a heart attack. However, heart disease is the leading cause of death in the United States for both genders. In fact, since 1984, more women have died of heart disease than men each year, although that is partly because women generally live longer than men. Researchers found women face a 20% increased risk of developing heart failure or dying within 5 years after their first severe heart attack compared with men. In addition, women were more likely than men to be older and have a more complicated medical history at the time of their heart attacks. Signs and symptoms of a heart attack. A heart attack can present itself in many obvious and not so obvious ways. It's important to recognize these signs because quick action can save a life. Chest pain. The most common symptom of a heart attack is chest pain. A chest pain can feel like pressure, squeezing, or even a burning sensation. Women, however, may not experience the classic chest pain as shown in TV shows and movies. Women usually complain of feeling down or having a severe feeling of doom. They may feel extremely tired, and may have difficulty doing regular chores. Some patients may even break out in a cold sweat. Shortness of breath. During a heart attack, a patient might feel like they can't catch their breath or are gasping for air. This symptom may get masked if a patient has a respiratory condition such as asthma or COPD. Nausea and vomiting. Some people experience severe nausea and may even vomit. If there is no reason for vomiting or nausea, then consider it as a symptom of a heart attack and seek medical attention. Pain in other parts of the body. Pain can radiate to a person's arms, neck, jaw, and back. Men usually show the typical signs of chest pain, shortness of breath, nausea, or pain in the arm or jaw. Women, however, may show multiple subtle symptoms in addition to, or excluding of, these symptoms, such as a feeling of heartburn, dizziness, and lightheadedness. Treatment. If you or someone you know experiences these symptoms, it's crucial to act quickly. Call 911 immediately. Emergency medical care. Paramedics and doctors are trained to provide immediate medical attention. They can administer life-saving treatments and medication. In some cases, your paramedic on the 911 call may advise you to take aspirin to slow the progress of the heart attack. Aspirin has shown to be efficient in buying time for patients until they receive proper medical help. Angioplasty and stent placement. In the hospital, a procedure called angioplasty may be performed. This involves inflating a balloon in the blocked artery to restore blood flow. A stent, a tiny wire mesh tube, may also be inserted to keep the artery open. This helps move blood through the artery to ensure that parts of the heart do not die. The heart tissue does not repair itself, and if lost, cannot regenerate or replace itself. Depending on where the artery got blocked, the amount of heart tissue damaged may be significant. Medications. Doctors may prescribe medications to help manage the condition and prevent future heart problems. Patients need to take these medicines regularly and actively change their lifestyle, eating patterns, and stress levels to reduce the risk of having another heart attack. Any further heart attacks increase the risk for the patient and may lead to severe complications or even death. Lifestyle changes. People with heart conditions or previous heart attacks need to drastically change their habits and lifestyles and remove factors that led to the heart attack. The risk of having another heart attack is extremely high in patients, and therefore, all precautions must be taken to reduce that risk. Patients may need to improve and even modify their exercise and sleep regime. They may have to change their diet, which should include low salt and fat. Patients may need to establish a regular routine of visiting their physician and having blood work and heart investigations carried out to see the progress of the disease. Finally, patients with heart conditions need to modify their life to reduce stress and anxiety. For anyone, it is very important to learn cardiopulmonary resuscitation or CPR and how to use atrial defibrillation device or AED. Immediate CPR and use of AED significantly increases the chances of a person surviving a heart attack and prevent death in cases. To summarize, heart attacks are serious medical emergencies caused by blockages in the heart's blood vessels. Recognizing the signs and symptoms and seeking immediate medical help is crucial for the best chance of recovery. Keep watching our videos to learn more about heart diseases. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.